There's a lot of discussion about how the last mile of an eradication program is the most difficult, but we are truly in the midst of that last mile and experiencing firsthand that it is going to be a very long and arduous last mile. Not so much as in taking more than the next 7 years, 5 to 7 years, but just knowing that it's going to be a slow roll to get to zero. The national programs continue to improve the implementation of interventions, and the program continues to invest in a robust research agenda that we actually think is going to help accelerate this end game. So over the past 3 years, we've shown progress against animal infections in particular, while continuing to reduce the number of human infections. But if we're able to develop and deploy diagnostics to help understand who has Guinea worm, even if they don't have an emergent worm, being able to identify Guinea worm in water sources before people might drink that water source, or animals to be infected from those water sources, we'll actually be able to shorten what, at least right now, is a longer last mile. So it's really been a long journey since those early days, when there were 3.5 million people annually infected with Guinea worm disease. So it's a huge feat to now be reporting only 13 infections. That's a long way from 3.5 million. But certainly, as we were talking earlier, the last mile is the most difficult. It's going to be cases occurring in communities that are the most difficult to access, oftentimes inaccessibility of safe water, inaccessibility of basic infrastructure or healthcare, and oftentimes in populations that are very much marginalized within their own countries. But I think one of the biggest challenges, even beyond the reality of conflict and war, or inaccessibility or lack of access to safe water, is really that you're talking about populations that are struggling to survive day to day. And so when you're working in communities where they have a litany of challenges and issues, they have a hardship of just finding enough food for 1 square meal a day, being able to prioritize spending that extra few minutes to filter water might seem like low-hanging fruit and easy to do, but it's really not that much different than saying wear a mask to prevent the spread of COVID-19 or RSV. Sometimes different diseases will be pushed down the ladder of priority. But I think the saving grace to the global campaign is that there's still a lot of people that know firsthand how bad Guinea worm is, and they've been able to share their stories with their families and with their communities. And so that there generally is kind of a fear of how bad it is to get Guinea worm. And I think that's why we continue to see the kind of historic low number of human cases at this time.